Feline CalciVirus, or FCV, is a common respiratory virus that affects cats. It's highly contagious and can cause a range of symptoms from mild to severe. FCV is one of the two common causes of upper respiratory infections in cats, with feline herpes virus being the other. This virus is a significant concern for cat owners because it can lead to serious health problems, especially in kittens and older cats. Understanding FCV, its transmission and how to prevent it is crucial for all cat owners. FCV is spread through direct contact with infected cats or contaminated objects. This can include sharing food and water bowls, using the same litter box, or even just being in close proximity to an infected cat. The virus can also be spread through the air, particularly in poorly ventilated areas. Once a cat is infected with FCV, it can shed the virus for several weeks or even months. This is why it is essential to isolate infected cats from other cats in the household and to practice good hygiene, such as washing your hands thoroughly after handling an infected cat. Feline CalciVirus can manifest in a variety of ways, and the severity of the symptoms can vary greatly depending on the strain of the virus and the overall health of the cat. One of the most common signs of FCV is an upper respiratory infection, which may present as sneezing, nasal discharge, and conjunctivitis, or inflammation of the eyes. Cats with FCV may also develop ulcers on their tongue, gums, nose, or lips. These ulcers can be painful and make it difficult for the cat to eat or drink. In some cases, FCV can also cause fever, lethargy, and loss of appetite. If you notice any of these symptoms in your cat, it is essential to seek veterinary attention immediately. Early diagnosis and treatment can significantly improve the outcome for cats with FCV. Diagnosing FCV can be challenging because the symptoms can be similar to other feline respiratory infections. Your veterinarian will likely perform a physical exam and ask about your cat's medical history. To confirm the diagnosis, your veterinarian may recommend laboratory tests, such as a polymerase chain reaction test, which can detect the presence of the virus in a sample of your cat's blood, saliva, or nasal discharge. Treatment for FCV is primarily supportive and focuses on alleviating the symptoms and preventing secondary infections. Your veterinarian may prescribe antibiotics to treat or prevent bacterial infections, as well as pain relievers and anti-inflammatory medications to reduce fever and discomfort. In severe cases, hospitalization may be necessary to provide intravenous fluids and nutritional support. Preventing FCV is crucial, and vaccination is the most effective way to protect your cat from this highly contagious virus. Kittens should receive their first FCV vaccine at around 6 to 8 weeks of age, followed by booster shots every 3 to 4 weeks until they are about 16 weeks old. Adult cats should receive booster vaccinations every 1 to 3 years, depending on their lifestyle and risk factors. In addition to vaccination, there are several other things you can do to reduce your cat's risk of contracting FCV. Keeping your cat indoors, away from potentially infected cats, is one of the best ways to prevent infection. If you have multiple cats, it's important to isolate any new cats or cats that have been exposed to FCV for at least 2 weeks to prevent the spread of the virus. Regular hand washing, especially after handling other cats, is also crucial. Finally, maintaining a clean and stress-free environment for your cat can help boost their immune system and make them less susceptible to infections.